welcome to our session on innovations in home health, lessons from COVID-19 and impact on future kidney care. I'm Jennifer Jones, a retired Marine veteran, member of both the AAKP National Board of Directors and Executive Committee and an AAKP National Ambassador. My kidney journey began while deployed to Afghanistan in 2011, and what felt like a blink of an eye, I went from serving as a combat camera videographer to being medically retired in 2013 due to being diagnosed with a rare autoimmune disease called membranoproliferative glomerulonephritis type 1 idiopathic. After starting dialysis, I felt out of control of my life and my situation. I knew I would have to make a conscious decision to take back control of what I could and be my own best advocate. I went on to share my story and found a living organ donor in 2015. Due to rejection, I recently returned to dialysis, but not without hope, faith, and a plan. When I returned to dialysis, I knew immediately I wanted to pursue a home dialysis therapy. I felt home dialysis would give me more control over my life, my schedule, and my health, so I pursued peritoneal dialysis. Additionally, as the coronavirus pandemic continued, with kidney patients being noted by the Centers for Disease Control and Prevention as a group that is at severe risk of complications if they contract the virus, I knew a home therapy was the right choice for me to help me stay home and stay safe. I'm pleased to share that I'm currently on track to receive a kidney from another living donor. I became involved with AAKP because I wanted to join a group of like-minded individuals who were passionate about improving the quality of life for all kidney patients and their caregivers. Who better to understand the needs of the kidney patients than the kidney patients themselves? Being a part of AAKP has allowed me to be a member of the AAKP PERCORI-funded Peer Mentor Project Stakeholder Committee, the Stakeholder 5 Committee with the Scientific Registry of Transplant Recipients, the Black Women's Health Imperative Rare Disease Diversity Coalition, multiple Capitol Hill Advocacy Days, and much more. I would now like to move forward with our session and am pleased to introduce our panel of speakers, which includes Dr. Jessie Roach, Senior Medical Director of Health Equity for CVS Kidney Care. Dr. Roach, I turn it over to you.
Hello, I'm Jessie Roach. I'm a Senior Medical Director that focuses on health equity for CVS Kidney Health. I'd like to thank the AAKP for inviting me to speak with you. It's always a privilege to be here, and I always enjoy it. I've been here several times in the past. So we'll get started. So what we're going to talk today is about home health and lessons that we learned from COVID-19 and the impact on future kidney care. So as everyone here knows, COVID-19 was particularly hard on those with kidney disease, patients living with kidney disease. And I just have a couple of numbers here that illustrate it. So the 7 times number, so patients on dialysis had a rate of hospitalization of 7 times that of the general Medicare population. In fact, dialysis patients were more likely to be infected, partially due to the fact that they are immunocompromised to some degree, and also due to the fact that for a lot of them, they had to go to dialysis centers 3 times a week and congregate with other people, when we knew that being indoors was particularly harmful for being infected with the virus that causes COVID-19. The next number this is 8.7 to 12.9. which is, it's a little complicated number, and I'll go into it. It's the number of excess deaths in the dialysis and transplant population for every 1,000 patients. So basically, what CMS did was they looked at the number of deaths that occurred during the months of February to August of 2020 and compared that to the number of deaths that occurred in dialysis and transplant patients in the years prior, so 2019 and 2018. And they figured out that there were 7 to 10,000 excess deaths compared to what had happened in previous years. This isn't definitely attributed to COVID-19, but it's highly likely that COVID-19 had a significant amount to do with it. So dialysis patients were particularly affected, and so that's what we're going to talk about today. So some of the lessons that we learned for what we should do going forward. One, bring care to where people live. So as I mentioned before, one of the risks of patients getting infected with COVID-19 stemmed from having to come into a dialysis unit. So I think one of the things that we have taken from that is that we need to focus more on getting patients care at home, or at least getting patients care closer to where they are, so they don't have to travel, don't have to take public transit, don't have to be crowded with large numbers of people. That could be home therapy, such as home dialysis or peritoneal dialysis therapies. It can be maybe therapies centered in places that aren't as large as dialysis facilities, that are more tailored for individual patients. So I think bringing care to where people live is important. I also think getting some of the ancillary services that are associated with care closer to them, so patients don't have to travel and patients don't have to end up in large crowded places, is also a benefit. I also think it's just a benefit in terms of having improved quality of life for these patients and just giving them a choice of what type of care they want. And so I think some of these things were true prior to COVID-19, but as we have seen in a number of aspects of our society and in the healthcare system, COVID-19 just sort of exacerbates things that we knew were there before. Speaking of which, ensure equitable care for all patients. And so one of the other things that we noticed from COVID-19 is that African American and Hispanic patients were much more likely to be infected with, be hospitalized with, and die of COVID-19. Again, this is one of the things that the pandemic or public health emergency exacerbated problems that were already present in our healthcare system. We know that African American and Hispanic patients are more likely to have kidney disease. And when you compare it to their proportion of the population, they're less likely to get referred for transplant care. They're less likely to get a transplant. They're less likely to be offered home therapies. These are all things that improve patient outcomes, allow them to live healthier lives, and allow them to live happier lives. And so this sort of was exacerbated by the pandemic, but it was there before. And it's something that we need to focus on, especially if we're going to make sure all of our patients get good outcomes. That could include having more people that look like the communities that they're serving, or just making sure that we educate people and don't let internal biases get in the way. And then third, patients with kidney disease have unique health needs and vulnerabilities. And so this is something that we knew prior to the pandemic. This has been laid bare by COVID-19. So patients that are on dialysis are immunosuppressed. They're more likely to get infected. We should take that into account when we're figuring out what care to give them. Maybe having them dialyze at home is better so that they're less susceptible to infection. Patients have unique dietary needs. They have unique needs with blood draws. Again, things that we already knew, but things that I think if we're going to make plans going forward, I think we need to recognize. So who we are at CVS Kidney Care. So we're just reimagining the future of healthcare. So we have started a kidney care company, and we hope to use the resources of CVS to improve care for everyone that has kidney disease. We have patient insights, which are grounded in our connectivity. We have lots of data. There's a CVS on every corner. We have minute clinics. We have health hubs. And we want to use that data to, one, know where patients are, to know what their health problems are, and we want to provide integrated health care. We also are focused on creating equitable systems and practices that close the gap in health equity. We want to try and make sure that certain populations aren't the ones that are dying more frequently from kidney disease. We're looking at finding ways to predict who is going to progress to kidney disease and intervene to try and prevent that from happening in the first place. And then once it does happen, we want to make sure that they're getting care that's appropriate, that is in line with their wishes, and is equitable. Make sure that everyone has access to good outcomes and all of the therapies that are available. And then patient-centered care supports patients when they need it. So making it possible for a nephrologist to focus their valuable time on the cases that need them most. So we want to set up a large support group for patients that's not necessarily physician-based. We have lots of resources all around the country, and I think we want to leverage that to make sure patients are getting what they need, and that we're able to develop personalized plans for each patient that fits their desires and what they sort of want out of their life. So some of the results we've gotten from our disease management. We have so far over 5,700 members who are engaged. We've had a 24% increase in planned dialysis starts. So a lot of mortality associated with dialysis happens at the beginning when people start care. So a lot of people are hospitalized and die because of that, and that could be helped. And a lot of that's because patients don't realize they have kidney disease, and they come see a doctor, their kidneys aren't working, and it's an emergency. And as you know, things when they're an emergency don't always go well. You have more likely to have a catheter, you're more likely to get an infection, you're more likely to end up in the hospital and die. So if we can decrease the number of emergency starts and increase the number of planned starts, that's better for everyone. We have 89% engagement with the patients that we have, the systems that we've worked with, and we have 98% member satisfaction. We also have had double the amount of home use. So that's something that we've been focusing on. We want people to dialyze where they want, and a lot of times it's at home. So if we can increase that, that's been a priority of ours, and I think it's important. I think that's something we're working on, and I think that's where we need to go in terms of what we're doing for patients with kidney disease. And then just an example of what we've been doing to try and bring care to patients. We've last month launched a pilot in Austin, Texas, that aims to transform the way dialysis patients receive their monthly labs. So one of the pain points of home dialysis is having to come into a clinic that's maybe far away, involves a lot of travel or multiple bus transfers. So trying to relieve that is something that we think is important. So this approach, we leverage our minute clinics and the health hubs to use phlebotomy services to offer patients convenient options outside the dialysis unit. So we've done this in a partnership with our minute clinics, health hubs, Ascend Labs, and Satellite Healthcare. So we're not interested in building up a lot of resources. We want to partner with people who are out there already providing good care. And then it began at 2 Austin retail locations, and it's set to expand into other major markets in California and Pennsylvania by the end of 22. So this is a small thing, but it's something that patients deal with every month. And it's important that we try and alleviate any difficulties that they have in getting their care. And I think that this is just an example of what's to come, how we can use CVS's footprint to improve care for patients and make it more convenient for them and give them access to more options than they would have in the past. In summary, COVID-19 was hard on dialysis patients. It showed a bunch of flaws that were in the healthcare system that were there previously, but it just exacerbated them. We're not providing equitable care in the way that we should. We aren't meeting the patient's needs in the way that we should. Patients aren't getting access to the technology and care options and the outcomes that they should. And we're trying to have a system where we treat everyone equitably. We give everyone access to modalities and to treatment options that will make them happy and healthy. And we want to make sure that we make providing care to them easy. We don't want to make it hard to get care. We want people to get care where they want and where they'll be the happiest. And so I look forward to working with everyone at AAKP and everyone here to help make those goals a reality. Thank you for your time, and thank you for allowing me to present. And I hope you have a good day.
Thank you, Dr. Roach. We appreciate your presentation. If you would like to learn more about home dialysis options, please visit the AAKP website at www.aakp.org and click on the Education and Resources box at the bottom of the home page, or check out additional information under the Center for Patient Research and Education tab by selecting dialysis. You can also find the latest COVID-19 information impacting kidney patients by clicking on the red Coronavirus Information button at the top of the AAKP website. Again, we thank all of today's speakers and thank you again for joining us.